afternoon and good evening, ladies and gentlemen, and our viewers globally. My name is Olatuja Gabriel from Virtual Doctors Nigeria. This is Virtual Doctors Head Talk Show. This is Head Talk Show with Virtual Doctors, and today we have our guest that is a medical doctor who by name is Dr. Biakolo Akpobome from Federal Medical Center Yenagoa. So today we'll be discussing pelvic inflammatory disease. So there's a lot to learn today, and as you all know, that our aim for this particular program is to bring health awareness to every one of us and for everyone to remain healthy. And one of the goals of virtual doctors is to make health care accessible and make it available to everyone and at affordable rates. And the one we are bringing to you today, which is a free health talk show, is a free information that you are going to get from here, such that you remain healthy, especially women. This is for you, and for you, husbands, brothers, fathers. This program is also for you, such that you can learn from this and also put your women, your ladies, your girls, and extend this awareness to them about pelvic inflammatory disease, the preventions, the treatment, and at the same time, every other thing, symptoms, and a lot of things that the doctor is going to discuss today. So let me use this moment to welcome Dr. Bill Akpobome. Thank you. Doctor, you're welcome.
Yeah, thank you very much. Dr. Biakolo-Akpobome, a medical obstetrician gynecology based in Yenagoa, Bayelsa State. I'm very happy to be here, and I'm going to discuss a very important issue, which is pelvic inflammatory disease. From this, the objectives of this discussion is to, most importantly, tell you what pelvic inflammatory disease is, because most people may not be aware what it is, then how it can affect the female reproductive system, the complications that may result, and the management of these complications too, and also the prevention, which is most important, because prevention is usually better than cure. Thank you. So I will start with the incident. Usually it's estimated that more than 750,000 people in US are affected by pelvic inflammatory disease, and it has a high cost burden, up to like $4.2 billion is spent on it, and results in hospitalization of female of reproductive age group. This has resulted in particular emphasis on pelvic inflammatory disease. By definition, pelvic inflammatory disease is an ascending infection of the female genital tract, that's the female reproductive system, affecting the endometrium, that is the lining of the uterus, the lining of the womb, affecting the fallopian tube, the ovaries, and the pelvic peritoneum. In other words, it's an ascending infection that affects the female reproductive system, and it usually occurs in the absence of pregnancy or pelvic instrumentation, that is, in the absence of any form of operation within that area. It's usually more common among adolescent age groups. It's also common. There are many risk factors that may be involved in pelvic inflammatory disease, and this includes children of usually adolescents, the younger females, then people who have had previous history of pelvic inflammatory disease, people who have been infected with sexually transmitted infections such as gonorrhea and chlamydia, people who have male partners who have sexually transmitted infection, then multiple sexual partners, people with multiple sexual partners. It's also common among those that are dutching, and those with insertion of intrauterine device with people with bacterial vaginosis, people on oral contraceptive pills, and also it's common among people, commercial sex workers, which are usually people who could engage in unprotected sexual intercourse. Most cases, the pelvic inflammatory disease is caused by um implicated by organisms, most frequently gonorrhea, which account for about 30 to 80% of infection. Then chlamydia trachomatis, which account for about 20 to 40%, and they are present in combination in about 25 to 75% of cases. This usually involve, it first starts with the cervix, which causes cervicitis. When it involves the lining of the womb, that is the endometrium, it causes endometritis. Then if it involves the fallopian tube, that is, it could cause saphingitis, ophuritis, or tubo-ovarian abscess. And when it finally enters the abdomen, the peritoneum, it causes peritonitis. In other words, this is an infection that spreads starting from the mouth of the womb and goes up until it gets into the womb itself and even gets to the ovaries. Usually, a person with pelvic inflammatory disease could have complaints such as abdominal pain. Usually, the person complains of pain. He will be complaining of abnormal vaginal discharge. Then there's also complaint of itchy sensation of the vagina. The person may or may not have fever, that is, there's hotness of the body. When this complaint becomes severe, that is, it becomes unbearable, such such women present to the clinic for management. At presentation, the first thing the doctor does is to ask, that is, this involves history taking. You ask the patient. Usually patients like this, they have a history of sexual intercourse. They are usually sexually active individuals. Either they may have multiple sexual partners, or even it could occur in women of reproductive age group who have a partner with multiple sexual partners. They usually following getting this history. The next thing will be to examine the patient, that is, to confirm what is to be managed, that is the pelvic inflammatory disease. On examination, usually when the doctor examines, to check for those who usually present with abdominal pain, they complain that they are feeling serious pain, and they also have abnormal vaginal discharge. Usually, on examination, there's uterine tenderness, that is, a little touch or light touch on the abdomen causes serious pain, and there's usually tenderness when doing vaginal examination. Other things that could be a pointer to the presence of pelvic inflammatory disease include fever. Usually, these people may have a very high temperature, more than 38 degrees. There's usually abnormal vaginal discharge, which is usually contains pus. There is presence of there's usually abnormal laboratory tests, that is the blood parameters. When there are usually blood investigations that are done, and it usually shows that there may be high white blood cell count, there may be high erythrocyte sedimentation rate with elevated C-reactive protein, and on swab to be taken, that is a part of the secretions, the discharge that comes out, to be taken to the lab. And usually when this is taken to the lab, there is usually detection of the infection, that is the causative organism of the infection, which is usually either chlamydia or gonorrhea infection. In this patient, usually apart from this investigation, other investigations could be done especially in very serious cases. And these investigations include endometrial biopsy or a transvaginal scan, or there could be a laparoscopy or transvaginal magnetic resonance imaging. In these patients, most importantly, at presentation, there need to be an emergency treatment, and this treatment will be based on the age group of the person presenting, the complaint which the person presents with. Based on the age group, usually if it's a younger female, it means the person is just starting her reproductive career. She's just trying to, she's not yet married, and maybe in the future may want to have children. In such individuals, there may be need for admission and giving of injections instead of tablets, because there may not be adherence to intake of oral medications. There are other individuals, such as people who have HIV/AIDS and equally have pelvic inflammatory disease. There's need for admission and administration of injection instead of tablets. Also, in individuals that have reduced suppressed immune system, that could also need hospital admission. For other cases which are not so severe, there could be administration of oral medication, that is tablets, and this individual could be allowed to go home and take those medications. So there's also if there's vomiting, that is, the person cannot take anything through the mouth, there's need for use of injections for treatment. And the drugs that are usually used are antibiotics. When the individual, the patient, the female presents, immediately there's administration of what they call broad spectrum antibiotics. These are antibiotics. They are drugs that fight infection, but they are not specific for a single type of infection. It means that they can fight any form of infection. So in this way, this individual is covered for this period, pending the time all the tests will be done, and then the causative organism will be identified. So in these patients, in the broad spectrum antibiotics could be ceftriaxone, or what some call ruxolitinib, could be given. Doxycycline could be given, and metronidazole. This is usually given. The ceftriaxone is usually given by injection, which is once, a single dose, whereas doxycycline is given for like 2 weeks, and metronidazole could be given for 2 weeks also. In another alternative, which is like a second line drug, another alternative to ceftriaxone is cefoxitin, which could also be given in addition to doxycycline and metronidazole. Other third generation drugs could also be given, such as cefixotin and ceftaxime. In addition to doxycycline, with or without metronidazole. Usually, there's monitoring of the patient within 72 hours, and within 3 days, there should be an improvement. If there's no improvement, there's usually a repeat testing is usually done. And those who are still having symptoms and who have not shown remarkable improvement may be retested for HIV infection. In event that such a person could not take oral medications, there's usually administration of injections such as cefoxitin and nefuroxime. Cefoxitin in addition to doxycycline. This is usually given intravenously, that is through a drip, and is given for every 24 hours for cefoxitin, and for cefoxitin is usually given every 6 hours. Then there could also be giving of clindamycin, which is also an effective drug, in addition to genticin. Other drugs include ampicillin and doxycycline and clindamycin. All these drugs are to ensure that patients returns back to a normal reproductive life. So this goes down to screening. What are the measures to prevent this from occurring? Because it's most important that patients don't wait till when they come down with an infection before we start the treatment. So in such cases, screening may be recommended for women who are sexually active and are 25 years and below, men who are sexually active greater than 12 years but they are high risk, such as commercial sex workers, pregnant women also, and could also be screened. Then for diets for chlamydia infection, then for gonorrhea, sexually active women under 5 years also, people with previous gonorrhea infection, people diagnosed with sexually transmitted disease, new or multiple sexual partners, people who engage in unprotected sexual intercourse, that is without use of condom, and also commercial sex workers and drug users could also be screened. Then an important part of prevention is also partner management. A male sexual partner of a woman with pelvic inflammatory disease should be properly examined. If they have sexual contact with someone else within 60 days of the female partner having pelvic inflammatory disease, there's need for screening. And if the last sexual intercourse is greater than 60 days, there should be looking out for the most recent partner. That is the last partner which the person, the female, has had sexual intercourse with. For the male partners, there's usually need for treatment as there's treatment for the female partner. And during this period, there's treatment for both chlamydia and Neisseria gonorrhea, regardless of if the person has any form of symptom or if there's any complaint. During this period also, such partners shouldn't engage in unprotected sexual intercourse with the female partner. Then consideration, an important part of prevention is counseling. Counseling, especially on adolescents, on healthy sexual behaviors. Counseling on how to resist peer pressure. Counseling on family planning. This also entails counseling the female on the nature of infection, what pelvic inflammatory disease means, how it can be transmitted, that even if you are not sexually active, for a woman who dutches means cleaning inside of the vagina, thorough cleaning with soap and water. This could also cause pelvic inflammatory disease. So by proper counseling and education, the nature of the infection, transmission, and risk reduction can occur. That is to assess patient's behavior and change potential. That is, in individuals like those who enjoy clubbing, partying, there could be high risk of engaging in unprotected sexual intercourse. So in such individuals, there's counseling on using of barrier method of protection, and also on avoiding places where there could be unplanned sexual intercourse. So there's discussion of the various methods of prevention of infection, and this form of prevention usually involves individualizing. Each individual has its own peculiar needs. The young adolescent is peculiar in the sense that they are not experienced and they are not aware of the dangers involved in sexual intercourse. Most people think it's only pregnancy that may be unwanted during sexual intercourse. For the adolescent, there's education and counseling considering the fact that apart from unwanted pregnancy, there are other risks involved in sexual intercourse. And this risk is an important risk is pelvic inflammatory disease. So discussion of the prevention strategies for this age group and other age groups such as commercial sex workers, letting them know that though it may be profitable having unprotected sexual intercourse with their partners, it involves a very great risk which could endanger their life. So educating them on the need to ensure they have a condom whenever they have any form of sexual intercourse with their clients. So this will also ensure reduction of sexually transmitted infection and reduction of pelvic inflammatory disease. Also, cessation of the practice of dodging. Considering the fact that many married women even engage in dodging, so reducing the incidence, reducing dodging also would ensure reduction of pelvic inflammatory disease. So in such cases, an important part is the follow-up. Whenever a person is being treated for pelvic inflammatory disease, it's important to consider a follow-up to ask if this person have been treated before. You ask what led to was the treatment complete, because in some cases people may undergo treatment but the treatment may not be complete, so it might be an reinfection. If the infection was not properly treated at the first instance, there may be a reinfection, which means that the person may come down with another event of that infection. So ensuring proper treatment and also ensuring that the patient is being followed up and is retested after the treatment to ensure that there's complete elimination of the infection is usually important. So and considering all this, there's also what the complications involved in pelvic inflammatory disease. When talking about pelvic inflammatory disease, apart from the initial complications where you have pain, at times you can have anemia, that is, there's reduction in the blood level. There are other complications which could involve which could happen in the long run. In the long run, such individuals may have subfertility and possibly may even have infertility. There could be chronic pelvic pain, in which in the long run there's a pain that is irretractable. The person feels extreme pain. It could even lead to abscess formation, and this could need surgery. And at times, in extreme cases, there could be death. Each of these conditions is usually managed accordingly. For the chronic pelvic pain, there's administration of the appropriate antibiotics, and also there is administration of pain relief that's analgesic to the individual. For cases of subfertility, such individual is being advised to go for fertility workup. Apart from prompt treatment of the infection, there's considering of the fact that other tests might be done, because in the process of this infection, there could be blocking of the tubes, and without the tubes, there could not be a pregnancy. There is a pregnancy occurring through the natural process. In such cases, such individuals may even need to undergo in vitro fertilization, that is artificial means of getting pregnant. Then in cases where we have sepsis, where infection has spread into the person's peritoneum, that is the abdomen, has spread all over the body, such people may need surgery. That is, there's what they call exploratory laparotomy. There's opening up of the woman's abdomen, what most people know as stomach, but there's opening up of the woman's abdomen to see the accumulated pus that is within the abdomen, and usually once it's seen, there's lavage, there's washing away of that pus, then administration of antibiotics, and with that there could be complete treatment in such cases. So each case is individualized based on the various complications, and if the complications are properly managed, there's usually reduction in the morbidity, that is the level of disease in this individual, and there's reduction in deaths that may occur in individuals with pelvic inflammatory disease. Having said all this, pelvic inflammatory disease is very important for in every woman, because we know that for every home there's need to have children, and considering the fact that pelvic inflammatory disease affect the womb, which is the important, very important factor involved when we need to have children. So considering that fact, I would enjoin all my audience to ensure that they take importance, make sure they take very serious every form of infection that involves their reproductive system. And there's no if the complaint, there's no improvement following treatment, they should see a doctor and ensure that they are properly treated and ensure that they get well to avoid the complications which I mentioned previously. Thank you very much for listening.
Wow, wow. This is excellent and very insightful. I learned a lot, and I believe everyone, all the listeners, have also learned a lot about pelvic inflammatory disease. Yeah. So I have some questions here, doctor, and I know that you have made mention of some of the questions that I have here, and you have in fact answered many of them. But for like a reiteration, such that audience can get some of these discussions, because you use some technical words which non-medical doctors might not be able to understand. So that's why I will still ask some of those questions so that you can be able to simplify for everyone to understand. So you made mention of uh, severe pain. Severe pain. Is it in the pelvic area or in the vaginal area? Which area particularly is this pain? So, like maybe it's common.
Usually, most the pain, the severe pain, it will also be in the vagina. For the pain in the vagina, it's usually felt during sexual intercourse. Usually, when a man is having sex with a woman, it should not involve pain, severe pain. But where there's pelvic inflammatory disease, the woman complains that each time there's penetration of the vagina, she feels extreme pain. That could occur in pelvic inflammatory disease. So it could involve the vagina. Apart from the vagina, it could also involve the pelvic region, the pelvic abdomen. That is, the pelvic region is the area where we have the entrance to the vagina, and the abdomen is going a little bit up. So both the abdomen and the pelvic region are involved. She could also complain of pain in those areas, pain on touch, and even pain without touch of those
Okay.
areas. So the pain involves all aspects, both the vagina, the pelvic region, and the abdomen.
Okay. And is it during the period? Okay, for example, ladies that have excruciating menstrual cramp, can this also associate or maybe be associated with PID, which is pelvic inflammatory disease? Like maybe whenever they have they see the administration, they have very excruciating menstrual cramp. Can that also be a symptom of PID?
Though it could be, though it's not specific in the sense that it doesn't mean that every woman that has severe pain would now say she has pelvic inflammatory disease during her menses. Mean that if you have severe pain, a woman that has severe pain menses will have pelvic inflammatory disease. But pelvic inflammatory disease itself is one of the causes of severe pain during menses, which is called dysmenorrhea. So it's one of the causes, but it's not the only cause. So if women with pelvic inflammatory disease also have severe pain, some of them may have severe pain. during menses, because pelvic inflammatory disease is one of the causes of that pain, but it's not the only cause. So we cannot just conclude that once a woman has severe pain during her menses that she has pelvic inflammatory disease. It's not so, because it's not the only cause of severe pain during menses.
Okay, thank you so much for that. So another
Yeah.
question that I have here is that okay, so apart from menstrual pain, you mentioned some of these symptoms for reiteration purpose. Uh, what other symptoms apart from apart from pains in the abdominal region, in the vaginal region, what other pains or sorry, what other symptoms can somebody that has a PID experience?
Such people could also have, like I mentioned earlier, that is abnormal discharge, abnormal vaginal discharge. Usually there's a normal secretion that lubricates the vagina, but when it becomes abnormal, it now start containing pus, and there's there could be the suspicion of pelvic inflammatory disease. Then apart from having abnormal vaginal discharge, the person could have fever. Usually it's not only pelvic inflammatory disease that causes fever, but in this case, person will have a fever that is continuous. Unlike fever in malaria, there's also fever, but malaria fever goes and comes. You don't see it throughout the day. But for pelvic inflammatory disease, this fever is usually throughout the day, and there's what they call high grade. The body is very hot. Unlike in malaria, which we may not have high grade fever, but in pelvic inflammatory, the fever is very high. The temperature is usually above 38 degrees. Normal temperature is like 37 to 37, but when you now start having more than 38, the body is very hot, and it's usually present throughout the day. Yes, could also be suspicion of pelvic inflammatory disease. Then such individuals could also come with vomiting. Then they could have a reduction in the blood level, which is called anemia. There's reduction in the blood level. Then if on further tests, you could get other in the anemia could make them weak. They will look pale, and they will be very weak, such that within, and could also even affect the heart, that they will be feeling as if their heart is beating fast. That you'll be having a feeling of taking note of the heart beating. That is called palpitation. So these ones are other form of, and some in very serious cases, like when we have sepsis, there could be also be in such individuals, there could also be swelling of the abdomen, that is swelling of the abdomen, and such people could even result to going to shock, which is known as septic shock. That is, they just collapse, they will rush them to the hospital following the collapse. So in such a person may be in shock, known as septic shock. So
Okay,
those are the other form or other ways where pelvic inflammatory disease could present in a woman that has pelvic inflammatory disease.
okay. Thank you so much, sir, for that answer. That is explanatory enough for anyone to understand. And whoever doesn't still understand this can reach out to the doctor directly on virtualdoctors.com.ng for more guidelines and doctor's instruction on the next thing to do. Also, I still have some other questions here, doctor. You spoke about sub fertility or sub infertility and co. Yeah. So you made mention that PID can lead to infertility or maybe sub fertility or something like that. So can you explain more on this? And when in a case when it leads to infertility, is it curable? Like, is this something that can be treated and that infertility can be cured?
Mm. Yes, I made mention of that. It's very important. That's why most women should take it serious, especially when they are just starting their reproductive career. For women who have not every couple to have children. And in the African environment, that is in the African culture, they take very high premium. They take it very important for every married couple to have their own children. So this is why pelvic inflammatory disease is a very important topic, and it's very important in the sense that it could make deprive those couples, especially newly wedded couples, of that joy of having children. This in the sense that pelvic inflammatory disease, apart, it could block the tube. For a woman to get pregnant, there has to be fertilization. That is, the egg that comes from a woman must meet with the sperm that comes from the man. And when it meets inside the woman, there is fertilization, and this could lead to pregnancy, where we now have a child. Subsequently, she gives birth after 9 months. But in such case, in pelvic inflammatory disease, when the infection has sensed, it's because the size of the fallopian tube is a very, very small tube. It's where the egg passes and where the sperm passes. The sperm is very small and the egg is very small. Considering the fact that the fallopian tube is very small, it can easily be blocked, because when there's infection, there's inflammation. That is, the body will now start reacting to that infection. In the process, this could lead to blocking of the tubes. Once the tube is blocked, there will be no place for the sperm to pass to meet the egg. And if this does not occur, there cannot be a pregnancy. So in such cases, this will be based on the different stages. That is why I said when there is subfertility, such cases should be such patients should prevent for fertility workup, because in the sense that you have identified that pelvic inflammatory disease may be the cause, you would have excluded other possible causes, because pelvic inflammatory disease is not the only cause of subfertility. So in cases where there are newly wedded couples, when they are having difficulty in having children, they need to first go for fertility workup, where they will now ask various questions. Then after the questions, they will examine, the woman will be examined to see if there's any other abnormality in her that will prevent her from getting pregnant. Then she will do tests to check, because for a woman to get pregnant, there are hormones that control reproduction. Such hormones have to be in the right quantity. If they are not in the right quantity, eggs will not be produced. And if eggs is not produced, there cannot be fertilization and there could not be pregnancy. So in such cases, there needs to be fertility workup to check all these hormones to see if they are in the right quantity. Then having done that, you can now also talk about the husband. Is the sperm being produced? Is the sperm being produced in the exact quantity? Because the sperm has to be produced, have the normal quality and quantity. If this is the case, that the quantity and quality of the sperms are normal, then we now consider the woman's reproductive system. There are various tests to talk about the woman's reproductive system. These tests may include the scan. The scan will be done. Then there could be tests for infection. Then there's tests to see if the tubes are blocked. If the tubes are not blocked, then it means there could be chances of fertilization. Then if there's any infection, this infection is treated. And then if the tubes are blocked, there are other means of fertilization, which is called in vitro fertilization. You harvest the eggs, then use the sperms to fertilize it, then reimplant the eggs subsequently for there to be fertilization. So in such cases, infertility can be treated after having identified the cause.
Okay, thank you so much for that. Yeah, thank you so much. Yeah. So question that I have here is that you mentioned if for example if a female partner has this disease which is pelvic inflammatory disease that the male partner should be treated too. So I want to understand why a male partner should be treated when a male partner does not have pelvic, like does not have, or does a male partner have pelvic that this same disease can also affect. Why should a male partner be treated?
Because chlamydia and gonorrhea are infections. Infections are like caused by tiny organisms. So considering those organisms can also, in the process of intercourse, those organisms can also enter into the male and they will start lying there. Following the treatment, if the male is not treated and only the female is treated, by the time the female now goes to meet the male partner, the organisms that would have entered the male during sexual intercourse will now enter the female. So it will be like a reinfection. So at the end of the day, it will be as if nothing has been achieved because the infection will still come, or the organism will multiply again in the woman and there will be another pelvic inflammatory disease. So in such cases, whenever they are treating the male partner, the female partner should also be treated to ensure that there is complete treatment and there's avoidance of reinfection subsequently when there is sexual intercourse between the male and the female.
Okay, yeah, that is well understood, and thank you so much for that, doctor. So I still have another question here. That okay, you mentioned that this infection can or this disease can affect the female reproductive organs, and this might cause harm. So I want to ask that in a case where this disease causes harm to the reproductive organ, is this something that can be treated and reversed, or maybe some harm can be like something that cannot be reversed? Because you made mention of IVF, that is in vitro fertilization. Now, for maybe in some cases, so I want to know, is it is the maybe if there's any harm, is this something that can be reversed?
So
Because
it's
I know we know that IVF, I don't know, is IVF affordable? For example, comparing IVF and maybe for example maybe IVF and somebody that maybe the the reproductive organ can be reversed. So in that case, comparing the two, maybe which one is affordable or preferable? If, for example, maybe we want to like balance and see maybe the one that's better.
that is why we usually when we are discussing such issue, we consider the environment we are in. Usually in this environment, that is the like Nigeria in particular, and maybe most of the developing countries, whenever the tube is being blocked, there are surgeries to repair the tube. There are considerations first. Those surgeries are not very common. They hardly do them in this environment, that is in this climate. And even if there's any possibility of doing it here, the chance of success is very, very slim. That is, they may end up doing it and there may still be no solution. That is the likelihood of it being blocked. A tube that has been repaired, there's what they call tuboplasty, repair of the tube. So it's more easily done in developed countries where they have the facilities for that. And the success rate is higher over there. But in developing countries like us, the facilities are not available and the success rate is very slim. So the patient may even end up spending more money because considering a surgery that is not very common in a country like us, you will have to pay more to do such surgery. And the chance of that surgery succeeding is even not very, very, very appreciative. It's not significant. So weighing that aspect is usually patients with a blocked tube are usually advised to just go straight for IVF without consideration of repair tube, because repairing the tube be a waste of money, a waste of time, and they may end up not achieving what they need to achieve, that is have a pregnancy. So the IVF is usually a more safer, cost-effective, and chances of success is higher using it. That's why I didn't consider that case. But in people, since this program is online, in developed countries, people in developed countries who may be hearing me would know that, okay, there are other methods that are available to them that they can use, like repair of the tube, which will be easier there, and the chance of success is also higher there. So in that kind of climate that is in developed countries, there is also consideration of tuboplasty, which is repair of the tube where the tube is blocked. Then also considering the other organs that may affect, apart from the tube being blocked, there could be effect on the heart. When a person when the blood level is very low, the person might have anemic heart failure. So that one also could also be an effect. That one is also treatable. That is by the heart doctors, by internal medicine, heart physicians, cardiologists. They will have to manage that. Then there could even be organ failure. It could affect other organs apart from the heart. So all these ones are contributing. Septic shock also, when there is effect on the other organs, there is spread of infection within all the organs. So most of these conditions are treatable. There's usually a treatment for it, and the chances of early detection usually increases the chance of survival, and the number of deaths are reduced if there's early detection and proper treatment in all these cases.
Okay, thank you for doctor. I think that is well understood. Like I usually say, whoever does not understand should uh, consult the doctor directly on our platform virtualdoctor.com.ng. Then, doctor, I got this question from one of our platforms, one of our channels. So the person is asking that vagina yeast infection, can this uh, can this be a symptom of PID, or can uh, vaginal yeast infection be a result of PID, or can PID be a result of vaginal yeast infection? However, you understand the question.
Okay. The vaginal infection is a sexually transmitted infection. So it's actually separate on its own, because it's usually due to is the infection within the vagina itself. The vagina have organisms that are living there, but a situation where there's is caused by Candida albicans. When it takes over the organisms, it becomes the predominant organism in the vagina. It could lead to vaginal candidiasis. And this itself is not pelvic inflammatory disease, but it could make the person susceptible. That is, people with vaginal candidiasis are more likely to have pelvic inflammatory disease, because there's already a weakness within, because the vagina itself, the reproductive system, has its own protective mechanism. But where there's already a weakness in the protective mechanism, it means there's chances that this mechanism can be easily defeated, and there's increased chances of pelvic inflammatory disease in females with vaginal candidiasis. So there are two different things, but they work together to achieve the aim of affecting the woman and making her sick. One affects the vagina, the other one affects the upper reproductive system. That is the uterus, the fallopian tube, the ovaries, and the peritoneum.
Okay, thank you so much for that. Another question, doctor, before we wrap it up, is about the tests. Yes, we are not encouraging anyone to go and carry out tests, though it's free to do tests, but then you don't. It's better to consult a doctor before you do anything. It's better to consult a doctor, and that's why we have virtual doctors that can easily give you information, even if you are still going to carry out the test, or you will be referred to an hospital that is close to you. Okay, so I want to know, doctor, which tests can one carry out to to detect or diagnose pelvic inflammatory disease?
There are various tests that's why it's good you emphasize the fact that a doctor needs to you need to consult a doctor before you can go ahead with the different tests. So the different tests have their own specific purposes. Like for a patient who presents, you want the blood level. So there's the full blood count done. It's complete blood count to check the level of the different parts of the blood, the red blood cell, white blood cells, if they are to check their level. Then having got that, if that is normal, there's also checking for the organisms. That is the endocervical swab MCS. Endocervical swab MCS can be done microscope culture and sensitivity. Endocervical microscope culture and sensitivity. This identifies the organism because you need to know the organism that caused it to know the appropriate treatment. It will also tell you the drug that will be effective in treating the pelvic inflammatory disease. So it identifies the organism, the causative agent, and also the drug that we treat the pelvic inflammatory disease. There are also other tests to confirm your diagnosis. So apart from identifying the cause, you also confirm that is this actually pelvic inflammatory disease. There's the erythrocyte sedimentation rate, there could be transvaginal scan, there is testing for like there could be laparoscopy, which is why the gold standard, which means is the highest level of test. Once a laparoscopy is used, boldly say that this is pelvic inflammatory disease is the highest level of test that can be done to identify pelvic inflammatory disease, apart from the other tests that I mentioned earlier.
Okay, thank you so much. And quickly, you've spoken about symptoms and prevention and treatment. So, are there preventions uh, are there prevention measures for that one can put in place in order to avoid or prevent pelvic inflammatory disease? And apart from that, is this treatment affordable in a country like Nigeria? Like, is it cheap to treat? Thank you.
Oh yes, okay. So the prevention is usually dependent on the cause. So it's not usually pelvic inflammatory disease is not only caused by through sexual intercourse. A person may not be having sexual intercourse, but the person may be engaged in douching. Douching is when there's cleaning of inside the vagina and water. The vagina inside the vagina is usually self-cleansing, that it cleanses itself. It has organism and other things that help it in cleaning up itself. But a situation where someone goes in with soap and water and cleans, it washes away its own natural way of cleaning itself. So this one could also cause pelvic inflammatory disease. So in such an individual who has been douching, this is called douching. That is when there's washing of the vagina with soap and water inside the vagina. If such a person is engaged in douching, after treatment, the person will be counseled that douching should be stopped, that it should not be done at all, because it's one of the possible causes of pelvic inflammatory. And when such an individual stops douching, and since this person is not involved in is not sexually active, or is not engaged in sexual intercourse at that point, there's prevention. But in other cases where pelvic inflammatory disease has actually been caused by sexual intercourse, in such individual, there needs to be first avoidance of risky behaviors, because some may be young adolescents that are under peer pressure. They engaged in sexual intercourse without planning for it. So such individuals, they will first be counseled on risky behaviors, not to engage in maybe abusing of drugs, taking excess alcohol, with clubbing. All those activities could lead to unplanned sexual intercourse, which could lead to an infection. that could lead to pelvic inflammatory disease. So apart from that form of prevention, for those who are engaged in planned sexual intercourse, like commercial sex workers, those who have sexual partners that actually plan the intercourse, they are being educated to use barrier method of prevention of infection, that is using of condoms. Condoms will ensure that there's no infection, and if there's no infection, there cannot be pelvic inflammatory disease. And then consideration of treatment. This is very important because most people avoid treatment because they feel it's too expensive. Pelvic inflammatory disease is not expensive. The treatment is not expensive, considering the fact that you don't it's not all cases identified at the early stage. You don't need to do an operation. There's no need for surgery. It can be treated with drugs. Even oral, that is tablets, can be used to treat it at the early stage. It's only when it gets to the late stage, if the person refuses to treat early and allows it to get to the late stage, that you can now start talking of having to do an operation, or having to give various forms of injections to treat it. So at the early stage, the treatment is very cheap. It's advisable whenever an individual identifies any form of infection, he should go straight to a doctor for treatment, because at that stage the cost of treatment will be very low. So it's better to treat at that point and not wait till when it would have caused various damage to various parts of the body, and that one will increase the cost of treatment. So early treatment is best, and early treatment is usually cheap and it's very cost effective. An average individual should be able to afford treatment if it's done at the early stage, because it's usually cheaper at that point.
Okay, thank you so much, doctor.
Yes, now.
Finally. So to wrap this up, finally, you talked about itching sensation. Is that itching sensation in the skin or in the vaginal area?
That is itchy sensation. The itchy sensation is usually in the vagina and the perineum, that is within
Okay,
the vulva. You can have itchy sensation. That is also a sign of infection, where um, within the private part, what most people call private part, the vulva and the vagina. That is where you have itchy sensation.
okay, thank you. So,
Yes.
like I said initially, so you can consult Dr. Biakolo Akpobome on virtualdoctors.com.ng. You can consult him right there. You do a video conference like this directly with him and him alone. Okay, he will be able to guide you. If you have to go to the hospital, he will let you know what to do, the test to carry out. In fact, he can treat you in a case that you don't need to take. He talked about maybe oral medication. Maybe in the case that you don't need to take injections and you don't need you don't need surgery. It's something that he can tell you what necessary treatment, sorry, test that you can take, and you come back to him live on that platform. After you come back to him, able to assess your results, your test results, and give you the necessary treatment right there. So we are making healthcare very affordable. That is what we do on virtual doctors, and this has also been made available for you right now. So you can grab into this opportunity of using virtual doctor and consulting the doctor, ask questions where necessary, and he will direct you on what you are expected to do. Doctor, it's been a great time with you today, and I believe our audience have learned a lot, and even the people that will watch later, even years to come, because this particular edition will be available online on our different platforms, on YouTube, on our website, and even on Facebook. These videos are streamed there, and a lot of audience are joining. And many of the audience will also still join later and watch this video to learn from it. Doctor, we appreciate you on behalf of our audience today. We appreciate your time, we appreciate your efforts and everything you have put together to come up with this particular edition with us on Head Talk Show with virtual doctors today. Thank you so much. Doctor, any final
Yes.
advice to our audience before we close the program for today?
And my final advice is that health is wealth. So if you are healthy, you are wealthy. So always take good care of your health so that you can be wealthy always. Thank you.
Thank you so much, Doctor. Thank you. And I believe if we have to call on you for another topic or subject of discussion, the other time you have time for us and you'll be available, sir.
Yes, I will gladly.
Okay, thank you so much, sir. And we appreciate you on Virtual Doctors. Thank you so much. God bless you.
Yes, amen. You're
Thank
welcome.
you. Yes, thank you so
Welcome.
much. All right, our listeners at home, at work, wherever you're watching from. Uh, this is the uh, ending of today's program. I mean, our head talk show with virtual doctors, and I believe you have learned a lot. So, we'll be having another edition very soon, which we will announce on our platform. If you have not been following us on Facebook, go and follow us now. Just search virtual doctors or at V Doctors NG at V Doctors NG. You can search for that on Facebook, on Instagram. Yeah, sorry, on Facebook is at V Doctors, V Doctors, V Doctors as a single word. That is the Facebook handle. On Instagram and Twitter is at V Doctors NG, at V Doctors NG. And on YouTube, we use this media agency, which is our sister agency, uh, that is e-reporters TV, that is Win TV e-reporters. So on YouTube you can just search for Win TV e-reporters. You'll be able to find all our videos on the different episodes and editions of virtual doctors. On YouTube, search Win TV e-reporters or go to our website virtualdoctors.com.ng/live. That is LIVE. So from there, you'll be able to see all our videos and also connect with our YouTube and click on the subscribe button such that you'll be able to get all our videos, even if you are not able to join us on some of our live editions. Thank you so much. My name once again is Olatuja Gabriel from Virtual Doctors Africa, Virtual Doctors Nigeria. Thank you so much and have a lovely evening. Bye bye. Namaste.